Good evening, colleagues, and thank you for joining our Champions webinar, the first one for 2022. I hope everybody had a well-deserved break and enjoyed the festivities over the seasonal time over December, whether you celebrate Christmas or not. Hope you all managed to get some rest and enjoy some time with family or even on your own or with loved ones. Our usual housekeeping, if I can just ask everybody to keep our mics on mute, unless obviously we need to speak. Please do use the chat function for questions or comments, or to indicate that you'd like to voice a question or voice a comment. The call is being recorded and it'll be uploaded onto our Healthy Brom YouTube channel, which you can view, and the link also will go out in the next edition of our Champions newsletter. And the agenda is on there. We've got a full agenda today. It's quite a lot of stuff to go through. Obviously, we haven't met for, I think it's almost a month. So we've got quite a lot of information to share with you. Okay, so what I'll do, without any further ado, I'll hand over to Shona and Emily, who will kindly give a brief COVID update in terms of what's been happening for the last month and the latest. So over to yourselves, Shona and Emily.
Cheers, Habib. Right, let me share my screen. Let's go entire screen. Okay. If someone could confirm that they can see that.
Yeah, it's good.
Brilliant. Thank you everyone for coming this evening and for taking your time to meet with us again. And yeah, like Habib said, I hope you had a very restful Christmas and New Year. And we're back here again to talk about COVID and everything that comes with that, and a little bit of data. So yes, myself and Emily will be presenting to you some changes over the last few weeks. So I will hand over to Emily now.
Thanks, Shona. Hi, everyone. So I'm Emily. I'm one of the public health graduates in the team, and this is my first time presenting to you all. So here are the statistics from this week. This is data up until the 15th of January. And we can see that in the new cases, there has been quite a substantial drop in cases this week compared to last week. So this week's around 12,000 compared to around 20,000 last week. And with this, we can also see that there is a reduction in the rate of testing. So this is the number of people reporting their LFT results and their PCR results to NHS Track and Trace. And there is a bit of concern that this rate has dropped. So we must all try and remind our friends and families and colleagues that if when they are testing with their LFTs, they should be reporting this, particularly if it is a positive result. And I actually had to remind my uncle of this myself. But good news is that with the percentage of tests that are PCR, the percentage of PCR tests that are positive, that's reduced from last week, although this is still a very high amount. And so Shona, if you can go to the next slide, please. So on here, for context, because I think us seeing week-on-week comparisons can be quite, I don't know if misleading is the right word, but it doesn't give the whole picture. So I wanted to show the data from our last meeting. So the data on the bottom here is from December the 12th to the 18th, where we had around 6,500 cases that week. And now compared to this week, we have 12,000. So this is a significant increase compared to our last meeting. And also if we look at the PCR positive test results, this is a huge increase compared to when we last met. So there's really a high burden of COVID in the community. And so if you go to the next slide, please, Shona. This is taken from the government website. So just to give a bit of context of what these cases look like over the course of the pandemic. And we can see that the cases have seemed to peak right at the end of this graph here. But this is still a very, very high level of cases compared to the rest of the pandemic. And so there's a very high level of COVID in Birmingham, and we do need to remember to be taking our LFT tests very regularly and using our safe behaviours as much as possible. Okay, over to Shona. Thanks everyone for listening.
Thanks, Emily. So we'll move on to vaccination uptake. So the first is our first and second doses. So we can see here that our kind of we're doing well. We are really making progress. So the first thing I say is to thank you for all of you who are encouraging your friends, your family, your neighbours, your communities to keep on getting vaccinated. And the NHS is very open with saying that regardless of whether you've had your first or second dose, even though you may have been offered months ago, that first dose offer is always open and will always be open going forward. So continue to, to talk to people about that and to encourage them to get their first doses, as any vaccine will provide you with a little bit of protection, which is great. So we can see here that our kind of 60 to 80 plus are doing quite well, trying to move towards that 90%, which is great. But under 50s, we're seeing this, we're still lagging behind a little bit with uptake. So, and again, some of this might be down to timings of vaccinations, but a year into the program, we're hoping to kind of see these start to pick up now. Moving on to boosters. A very similar picture, actually, almost completely reflective of what we've just seen with our first and second doses. And again, some of this stuff might be around timing. So I've just managed to have my my booster in December. So by the time that comes through and we can see it in data, we can see that it's still pretty low, but it's some of the lagging behind might be due to people just taking their time to get that sorted out because of when the offer was made available. But again, there are lots of places to be vaccinated across Birmingham now. So continue to please push with your friends, your neighbours and your communities, and let's try and get to 70, 80% as soon as possible. It's also worth noting here that I'm sure some of you would have heard, and some of you may also even be affected by the vaccine mandate that's coming out for NHS and social care staff. So yeah, we might see this figure. Well, I hope to see this figure go up in the next few weeks so that they can meet that 1st of April deadline for vaccination. So moving on to changes in government guidelines. Now, there was an announcement today, which we'll get into in a moment. But since we last met, there have been some quite significant changes that we wanted to talk you through very briefly. The first is around asymptomatic testing. So as you will now know, if you're asymptomatic, so if you have no symptoms and you take an LFT and it's positive, you no longer need to confirm this with a PCR. However, if you do have symptoms, so if you are symptomatic, you'll still need to have both your LFT and a PCR if that comes back positive. So, and that, like Emily said, it's really important that we continue to register our lateral flow tests as well. And I've put the link in there, but I'm sure you're all very familiar with it. Please do continue to register your lateral flow tests, whether they're positive or negative, and that helps to just give a really good understanding of testing rates across the country. The second thing we wanted to pick up on, is isolation. Now, I don't know about all of you, but some of the isolation guidance was quite confusing, and I spent a lot of time kind of doing my isolation maths over the last few weeks. But isolation can now be cut to 5 full days, and that is if you have a negative lateral flow test on day 5 and day 6. And we know that does cause a little bit of confusion. But hopefully we can start to release some information that will make that a bit easier to understand. And the final thing is around close contact. So if you're fully vaccinated currently, you do not need to self-isolate if someone around you has tested positive. Now, moving forward from tomorrow and over the next few months, there will be some significant changes around government guidelines. The first is around face coverings, so they will no longer be mandatory. COVID passes will no longer be mandatory. And for those of us who can work from home, we no longer have to do that. So that is something to keep in mind. And we'd always encourage that you think about your own personal risk when engaging in various activities. So for me personally, I'm asthmatic. And so if I was to catch COVID, I'd probably be quite nervous about kind of going out without a face covering personally or going into the office regularly. So for me personally, while the government is encouraging that you wear face masks in public, and it's no longer by law that we have to do that, I think I might keep mine on for a little bit longer at least, maybe when I'm on slightly smaller or enclosed spaces. So yes, this section now is all about kind of managing your own risk and still being sensible around some of those safer behaviours that we've been talking with you about over the last year. So that is it for our presentation for now, and we'd be very open to hear any questions, concerns, anything that perhaps you are hearing from your various communities. And of course, as soon as we get kind of confirmed guidance around some of those incoming rules, we will absolutely share that with you as soon as possible through our newsletter and through these webinars. So I hope that's okay. Any questions?
Sorry, thank you for that, Sean and Emily, both. There's some questions in the group. I know Emily's responded to one. So Deborah's got a question in the group chat. So I don't know if it's a question or a comment. I'm just reading it out. It is quite difficult to get hold of boxes of LFT. In the last few weeks, out of 9 orders placed in our household from individual images, we have received 3 boxes. Bearing in mind that since 8th of August, there were 4 using test eligibility. Yeah, so in terms of, I can pick that one up. In terms of the LFT test kits, there has been delivery issues. There hasn't been an issue around shortage, but I think when Omicron first came in, there was kind of like a massive kind of rush of everybody going online and ordering test kits. So that kind of like built up some backlog. But that online service has been resolved now. That's what I've been told. So please go ahead, continue to order online. The bulk ordering for certain venues at the moment, BCC, who delivers bulk orders for like place of worships and community centres and other centres where people can communally gather, those are on hold at the moment, simply again due to demand. What Birmingham City Council are doing, we're at the moment just trying to replenish our own existing sites and also supporting NHS venues for their staff and colleagues. So that's where you are with the LFD tests. I received an email yesterday or today, I think it was, saying that hopefully in the next 2 weeks, that issue should be resolved and bulk ordering should be okay again to process. Okay, I hope that answers that question. Fiona made a comment on off the back of your presentation, both Emily and Shona, the change of guidance. So the government are prepared to gamble with our health to save Boris' job. No comment. It's a disgrace. What is the idea about no longer having to wear face masks? Is this behind the reduction in the stats? I'll pass that one on to Emily and Shona.
I think it's difficult to say. I mean, unfortunately, I can't read Boris Johnson's mind, and I really wish at this time that I could. I really do wish I could. I can only speculate that perhaps because we are seeing rates coming down, hospital admissions coming down, and we're seeing more people taking the vaccine, that there's more protection, and therefore perhaps we can stop wearing face masks. But that is pure speculation, unfortunately.
I will just add that wearing a face mask is a really good way to protect yourself, and don't not wear one because the government say that it's no longer mandatory. If you can, wear one. Yeah, that's all I'd add.
Fiona has mentioned also when she approached her local pharmacy for an LFT test and they asked about a code. I'm not aware of that. I don't know if Shona, Emily, or Andrea. Yeah, Andrea, yeah, go ahead.
Hi, thank you so much for your question. So as far as I know, because I did the same, when you order your tests with the pharmacy online or on the phone, they will then give you a code, which you will then have to just share it when you go and collect your test kits. I hope that answers it.
All right, so that's if you order online, you get a code, which then you need to. Okay, but yeah, if you, I know that when I've approached my pharmacy, I've just gone in walk-in. They've given me the kit without a code, same as the pickup center. So maybe that's if you order online. Okay, thank you for that clarity, Andrea. I hope that answers that, Fiona. Becky saying also when going to pharmacies, yeah, most pharmacies are replenished now. I know there was an issue at the beginning of the month and towards the end of last year.
I can't put my hand up, I don't know how to put my hand up. So I didn't order online, I walked in.
Fiona, we can't hear you. Do you mind?
Can you hear me?
Well, it's quite low, the volume is.
I've got a problem. Yeah, I'm sorry, my mic's not very good. I just walked into the pharmacy to get a prescription for my husband fulfilled. And while I was there, I asked for a kit, and that's when she asked me for a code. So I hadn't been online to order it. So no, I'm afraid it doesn't answer my question, and I haven't got a clue what she was talking about.
Okay, we can take that back if it's okay with you. We can speak to our colleagues that deal with the LFT and find out if there is a new process in place in terms, like I said, when you go to pick it up, I'm not aware of that. You need to produce a code. Obviously, Andrea's clarified if you go online, then you get a code, but we can find out if you re-code for walk-in. Shona, did you want to add something to this? And then
Yes, thanks, Habib. So, yeah, I'm sorry that that was quite a frustrating experience for you, Fiona. And I wonder if perhaps the pharmacist perhaps misunderstood. I know I don't want to make excuses, but perhaps they misunderstood the difference between you picking up one that they had in stock and you having ordered one. Of course, that doesn't make anything easier because you still haven't got LFTs, but do keep trying, and if not, try online through the link that both myself and Benita have put in the chat. If you want to order one to a pharmacist, then you could do it that way, or you could order one directly to your home as well.
Can I just say, I went into Boots, and Boots are really good in Birmingham, because the actual assistant actually went through it on your phone with you and gave you the actual lateral flow test, and I've done that twice.
Thank you for that, Sylvia.
Yeah, that's great.
Hope Radio, you're on mute. Would you like to unmute?
Hi, yeah. The problem we've got is that a lot of my community that I'm talking to, they're not digital, and so they go into the pharmacy, and bless him, Raj, and he's giving them a form and saying, do you know what I mean? You need to go online to sort it out, and they can't get online. Do you know what I mean? It's like, well, so what they're doing is they're just going, oh, all right, screwing up the leaflet and throwing it on the floor. I'm not going to do it then, because if I've got to do it online, so because he hasn't got a stock in, so it seems to be yet again that when we need to start taking into account the 1.5 million of us, do you know what I mean, who are residents who don't have access to digital. It's all right if if digital was universal, then yay, let's carry on. But there's a lot of people who, for one reason or another, either don't want to or don't have the financial wherewithal or whatever to actually do this whole digital thing.
Yeah, I mean, I hear that. I hear that, and it is really challenging. It is quite difficult when you're constantly being pushed to go online, where people haven't got people are digitally excluded, and obviously it's been more so highlighted over the last 2 years how digitally excluded our residents of Birmingham are. I don't know how to answer, to be honest with you, but what I can say is that I'll hand over to you, Emily, one second. What I can say is that colleagues have confirmed that over the next week or two, that most of the venues that actually hand out our walk-in sites, like pharmacies and some of our own sites, they will be fully replenished over the next 2 weeks. So, nearby pharmacies, you should be able to just walk in and get one. My local Tesco's has a pharmacy, and I know people just come in and just grab it, and all they take is just your name and details, and that's the only information that you need to give. Emily,
I think the problem.
Sorry.
One of the other problems is that we've got, I don't know if you guys know, we're in Druids Heath, which is like south Birmingham.
Yeah.
We're literally on the border with Worcester. And one of the other issues that we've got is that the nearest 2 test centres for us, when I've got to go and get my booster, which I haven't done yet because I've had flu, I've got to go all the way to Sparkbrook. Do you know what I mean? Or I've got to go all the way to Moseley. Do you know what I mean? That's, Moseley's like 5-6 miles away. The other one's 5-6 miles away. Do you know what I mean? It's like, come on. Do you know what I mean? Can we have something a bit nearer? Can we have something in Warstock or Maypole or Hyters Heath or Walkers Heath, or do you know what I mean? That's not quite so far away, because one thing that's putting people off. I know they've got the taxi. I've been telling people about the taxi. Do you know what I mean? And the number and everything, and they can do that. But then the anxiety of somebody who's 70 years old, telling them that they've got to go all the way to Spark Hill, do you know what I mean? Which is a completely different environment to Druids Heath, to a whole load of people that they don't know. Do you know what I mean? And then get in a taxi with and then come all the way back. It's just like, they're just like going, no, I'm not doing it. It's too dangerous. I'd rather stay here than this is I'm just trying to feed back the information that I'm getting.
What would be helpful, Hope, is if there was any central venues in your area, Druids Heath, where organizations or establishments will be happy to store bulk test kits, LFT test kits, for your residents to be able to collect. Share that with us, and then once our stocks are okay.
What is it that you need? Do you need fridges?
No. These are LFD test kits. You don't need fridges. They're just the lateral flow test kits that you do yourself.
All you just need is storage then.
You just need storage space and where people can access. So if, say, for example, there's a I don't know, a church or a big shop or a community center, a facility that's open quite frequently and it's quite central to all your residents, then we could get bulk orders there, which will make it easier for your residents to access the test kits. The LFD test kits are the ones that just come in the boxes that you just pick up.
I know it's the day-to-day ones. Yeah, okay. I'll have a word and let you know and see what the story is.
Please, do that. Sorry,
Thanks.
Emily, waiting patiently.
Also, thank you for raising the point about the vaccine centres being so far away. We'll definitely feed that back to other members in our division, in the team. With the ordering test kits, that's definitely an issue, and there is, access to the internet is a huge issue that we really need to focus more on. But there is, as quite a few people have put in the chat, the coronavirus hotline, which is 119, and this service is provided, I think, like 7 a.m. to like 11 p.m. most days, and it's in, I think, like 200 languages, and basically anything that you want to do on the internet you can do on this hotline. And the other thing is that you can get a friend who is on the internet to order test kits to your house as well. That's all I wanted to add. Thanks.
Thanks for that. There is a question there. Sorry, I'm just trying to read through because there's quite a lot of messages that have come up. Yeah, it's from Mike about self-isolation will continue if you test positive. What should you do if you test positive when staying away from home if you cannot self-isolate where you are staying? I'm not sure if I'm honest with you, Mike.
I feel like this has come up before, but I can't remember what the guidance is. So say, for example, you're on a work trip and you're staying in if I'm honest, I can't remember what the rule is. I don't know if you try and get home as quickly as possible or if you make arrangements nearby, but we'll take that one away.
Sure. I think something similar I can share is that I know that when people are traveling from certain countries and they're coming, say, for example, to England, and it's not all countries you're traveling from, depending on what countries you are. But from my experience, I know a couple of countries where if you test positive just before coming onto the plane, you have to stay in that country and isolate, and it's at your own cost. They'll find you a venue, but you have to pay for it, and you can't get onto the flight back to wherever your destination is until you've completed the self-isolation. So similar, I don't know if it's the same as if you're working, I don't know, out of town or something, and you test positive, what do you do? If you've already got accommodation, say, for example, your company's putting you up in a hotel or a B&B, do you then stay in that B&B for another 10 days? Who pays for it? Does your company pay for it? You pay for it? Or if you're, I don't know, you're working, I don't know, on the motorway or something, or fixing the roads or whatever, and you test positive, do you then just quickly drive home? Yeah, we'll take that away and hopefully get a response back to you, Mike. Thank you for that question. Just trying to think see if there's any more questions in the group chat. Yeah, 119 is always a good option. Those that have got facilities to make the call, please do dial 119. Any thoughts of this? Anyone tried it? If you cannot use the online service, call 119. Free from mobiles and landlines. So we need to share the fact that 119 is free from mobiles and landlines. Lines are open every day from 7 till 11. 119 provided support, 200 languages. Some more FYI around. Would they be worried about taking free taxis? I'm quite worried about. So we've got a concern from Deborah about the fact that her son, who is still positive on day 10, how safe is he around other people, especially if his nan, who's in her 70s, is told no need to isolate, but still positive. I had this conversation earlier with Emily. I had shared the same concern. Emily?
I'm not a clinician,
No.
but this situation recently happened with my brother. So maybe don't take this as like absolute word, but I'd recommended to my brother, because he was around my parents, to stay like more distance from them as much as possible until he felt better. Because particularly he was still feeling ill on day 10. I don't know if anyone else has anything to add to that.
Yeah, I was going to say that.
Can I respond? Because I am.
Yeah, go for it, Jane.
And I sort of read quite a lot of the literature. The government making the rules about 5 days, 6 days is looking at percentages, and it's looking at the relative risk. So it's saying most people won't be infectious at that point, therefore they don't need to isolate. some people, like with any virus, are going to be infectious for much, much longer. And it gets fewer people the more time goes on. But I would be concerned if the son is still positive, that he could still be infectious, because everybody clears the infection at different rates. And they actually say in the guidelines, if you read the Gov.uk guidelines, they actually say, even though you can no longer need to self-isolate at day 6, you might want to be careful when you're around vulnerable people and people who are susceptible. So I would just be cautious about that, really, because he could still be infectious, although, you know, he's not ill or anything, but he can still pose a risk for people who are vulnerable.
Jane, that's beautifully put, and yeah, we would absolutely agree.
Thank you for that. I don't see any other questions. I hope I haven't missed anything out. When will the latest case number by award be available? Please, the case numbers by award, we got the ones that were shared were up to the 15th, was it? 14th or 15th?
15th. We didn't share the ward data though. Is that in the newsletter, Andrea?
Should be in the newsletter.
Yeah, so it should be in the newsletter, and the next edition will come out next Wednesday. So next Wednesday we will have the most updated one.
And we just got the dashboards, the full dashboard data today, and so there'll be a bit of a uploading period while we put it onto the website. So that will be that should be by the end of tomorrow. By the end of tomorrow, it'll be on the BCC website.
But that date is up until, I think, last week Friday, I think, yeah. That date is up until last week Friday. So it's about a 6 or 7 day lag with the figures. Okay. I can't see any other questions, so if you
there's just a comment from, I'm sorry Habib, there's just a comment from Deborah about her son still feeling unwell. I would say that it's just try and treat him like he's got cold, like he has cold symptoms. So continue to normal things like Calpol, getting lots of sleep, getting lots of food and liquids, and back just general kind of looking after him, and hopefully he'll clear soon. I know it's really frustrating. It's every as Jane said, everyone clears this stuff differently, but yeah. Oh, he's had no symptoms. All he had was a runny nose for 12. Yeah, it's funny. It's very funny. My housemate and my fiance, they both had COVID over the Christmas period, and both of them had no symptoms. And I was one that had a cold and didn't have COVID. Don't know.
Yeah.
There's just no answers to it. It's very strange. Very, very strange.
Apologies, Silver, that your newsletter still hasn't been resolved. Can we take this, Andrea, if you can pick that up outside of the meeting, please? Sylvia isn't picking up. I raised this a while back now. I had similar kind of problems, Sylvia, so I don't know whether it's something to do with the email address. I had to give a different email address to Andrea in order to be able to receive. So if you and Andrea, if you can pick that up with Sylvia outside of the meeting, please. I really appreciate that. Okay. And there's some other the dashboard info, link Emily has kindly put on the chat as well. Hopefully I haven't missed anything from the group chat or anything. Apologies if I do. I know it sounds as if I'm rushing, but we've got quite an extensive agenda, and I don't want us to miss anything simply because it's been so long since the last time we met. I'm just scrolling back up to see. I think the next agenda item is you, Shona, literacy project. Health literacy project, sorry.
So we're going to push this to our next meeting, if that's okay.
Sure.
Thank
that's
you.
Fine. Not a problem whatsoever. Okay, so next it's me on the agenda. Colleagues, you may be aware, last summer, we did a rapid review of the Champions Programme, and colleagues from 2 colleagues from University of Birmingham came along to our webinar and invited people to participate in this. Now, the report and information has been collated. An extensive report has been sent to the 16 or the people that participated in the review, and then obviously we would like to feedback now some of the findings from that review. What we can do is the report itself, we can share that with everybody as well. So if I just share my screen with yourselves. So let me know if you can see the screen, please.
Yeah.
Okay,
Yes,
excellent.
we can see.
Okay, so rapid review of the champions program. As I says,
Well, hang on, Habib, it's not full screen.
Oh, is it? Okay, sorry. Let me just go to slideshow. Is that better?
Yeah, thanks.
Okay, so as I said earlier, it was University of Birmingham that did the rapid review for us. Can people see I can't see my own screen. Can people see it?
Yeah, we
Okay.
can see it clearly.
Okay, sure. So why did we, so like I said, the Covid-19 Community Champions Program, it's a community-based COVID-19 prevention scheme run by ourselves, and it's a scheme that's nationally run. So it's not just Birmingham, there's several other local authorities that have got this champions program. The program was started in June. We started the program in June 2020, and University of Birmingham was invited to assess the champion scheme to consider, and the main reasons was to look at how we can recruit more champions, how we can retain the champions that we've got, and explore the activities champions are doing and how we can support them better with those activities, and if there was any potential for expansion of the current role that yourselves are doing. So that was kind of like the basic reasons why a rapid review was done. So the review took place from July to September 2021. It was, because it's a rapid review, we only had a short period to get the review done and get the information or feedback the information to the participants. How we did it, there was 3 focus group discussions, 4 one-to-one interviews, and an email interview. All in all, 16 champions took part in the review. A good split, half and half, almost 7 male, 9 female. Majority of the participants were white British, and the rest were, they identified themselves as white British, apologies, and the others are on the screen, as you can see. I'm not going to read them all. Champions that took part in the review were from across the city. It's a good spread, actually. If you read that, people from east, south, west, north. There wasn't a particular part of the city where a champion wasn't from, so that was really good. And those that participated, the champions that participated, they joined the actual program, some right from the beginning, some towards the middle, and some towards just a couple of weeks or months before the review actually took place. So what did we find out? So what we found out was quite a few things. I'm just going to talk through a few of them with you, not all of them. As I said, what we can do, we can share the extensive findings with yourself, so you get a more in-depth kind of opportunity to find out more in depth what the review revealed. So what was the motivation to be a champion? The participants that took part, there was various reasons for actually taking part. Some were personal situations, such as previous experience of volunteering because they enjoyed that, they wanted to volunteer again. Some were because of current employment status. Some they were retired or were unemployed, so they thought that it's something for them to do and also give back to the community as well. Some were for personal experiences of COVID. They felt that there was a lack of communication with authorities about COVID. There was a lack of information, and there wasn't many places to get accurate information. So they thought that if they volunteered on this scheme, they'd get the accurate information from a good source, which then they can feed back to their communities and residents. They wanted to make a positive contribution. And it's also, like, so being a champion was for some people, being a champion was complementary to their professional role. So some of our champions were school teachers, or they were already working in the community. So it kind of complemented that because they're already working with people. Some of the champions described having an unclear expectation of the program. They're a bit apprehensive about being a volunteer, simply because they weren't sure exactly how much responsibility it will need, or they'll need to show, time commitment, and also the sole use of online resources and interactions, something that we spoke about earlier in the presentation that Emily and Shona did in the update in terms of digitally excluded people. However, a lot of the champions that participated did say the role was as they, the more and more champion work that they did, the role became more clearer, and they understood exactly what it was that they were doing and why they were doing it. Okay. The next thing was around managing champions' email boxes. Regarding support that they expected to receive from the program organizers, they kind of like thought that some understood the program, and also the organizers were likely to be, the team will be a really small team. So in terms of responses and email responses, they understood that it would probably take a lot longer than they anticipated. Some stated that the support and provision for volunteers wasn't stated on registration, so they didn't have any expectations of what kind of support that they was going to receive. And others expressed discontent. They felt that the communication between us as public health and the champions could be improved. And so with these expectations varied in this regard. Some stated that the email responses within 3 working days was acceptable, so others hoped that they would get immediate replies. In terms of supporting the champions and peer support, reliance on remote technologies such as email and webinars due to the evolving COVID-19 content and guidance caused some difficulty for some. They had their respective audience, respective audience did not have internet access, as we spoke about earlier. So some of the reservations that several reported wanting instant answers to their queries, particularly when the participant was sharing information with members of vulnerable groups who were unable to seek information themselves, and in a position where they were trying to safeguard their well-being while navigating COVID-19 guidance. Some expressed frustration with what were perceived as vague or delayed responses from ourselves. And others reported having made contact with specific requests or observations, these being addressed or being acknowledged, they were being addressed or acknowledged satisfactorily. Some reported that changes being made as a result of the feedback and that this had been taking place with an acceptable time frame. In terms of peer support, some participants felt that it would have been good if opportunity allowed to buddy up with other champions just to share experiences, and also it's about pooling skills and resources and efforts together. And some of them specifically in terms of accessing other languages was a massive issue. And I thought that teaming up with the champions, they could have kind of like addressed that better than they did. Some suggested that coffee morning would have allowed volunteers to network, share information, and boost morale. One participant reported that they had agreed to share their contact information for this purpose, but this had not been used. Others felt that peer support would require greater time commitment than they could spare, that they prioritize access to the BCC's public health team instead. In terms of program content, some participants reported that the information shared by BCC was limited in terms of language and cultural sensitivity, too complex for the audience, so would use other sources of information too. It was all online, so inaccessible for some. Complicated, so champions might benefit from more training. Full of detailed information, enabling champions to do their own analysis, and originally very locally relevant, giving insights unavailable elsewhere. And there's some varied feedback on the webinars. For some, it was a great opportunity to get instant answers. They enjoyed the presentations. Being unable to speak, others said that being unable to speak due to so many attendees, so there's lots of numbers, they felt uncomfortable to actually make a comment or didn't get the opportunity to actually speak. Some said that webinar recordings were no longer available, which was difficult for those who couldn't join the webinars due to other commitments. And also some talked about inconvenient timing or delivered with short notice. And then others noticed that The content of the emails had changed over time. As originally there had been a lot of in-depth information, this had changed, so emails were less regular, less frequent, and less reliable. Content was less shareable, information was less locally relevant, and there was more non-COVID content. In terms of champions' activities, what champions did with the information, people who participated in the review reported targeting specific groups with information shared with them by BCC, including personal and local networks, veterans aged 70 to 100, neighborhood, religious and community networks, cultural communities including Spanish, French, Black, Asian, and minority ethnic group members, people receiving direct payments from adult social care, and BCC Legal and Governance Department. Participants also described that editing the information for their audience, removing non-COVID content. So as I said earlier, when they were getting information, if there was anything specific non-COVID, they'd remove that non-COVID information and just stick to the COVID information. And information was shared using a variety of different methods. So newsletters, group chats, emails, other social media platforms, face-to-face interactions with own network and in key community spaces. Some printed their own leaflets, making copies, leaving them in key community spaces and visible areas, telephoning offline groups individually, checking in with people that they had, ensuring that they had the correct information. Then around feeling valued and feeling valued by ourselves, public health. Several participants reported having had a positive experience of being a volunteer, that they had been impressed with the program, and that they had and would recommend it to others. For some, the changes in the program over time and the possible decreased continued need for this role meant they would not encourage others to join. So some gave positive feedback, recognition, and people being warm and receptive. Some felt that. Some were saying there's some sort of hostility and skepticism or indifference in terms of when they were sharing information with their communities. Some of them felt a sense of credibility being a champion, and many were unsure. A lot of them were unsure of in terms of what impact the information they were sharing was having on their communities. Continued need for the role. The focus group interviews had taken place. Well, the focus group interviews took place between July and September. At this point, COVID-19 pandemic was in a state of change. The English government, obviously the government imposed restrictions were being lifted and eased, and participants reflected on this and their continued efforts as a volunteer. The people who took part in the review described their understanding that there would be interest from the program, or from us ourselves, in maximizing the volunteers that we have. However, several expressed continued concern with the ongoing pandemic and felt that there was still a need for the role to remain specifically to COVID-19. So the participants felt that rather than moving away to non-COVID messaging because guidance was changing and restrictions were being lifted, there's still COVID concerns, and they felt that it's important that the COVID message was still at the forefront. So moving on to the next, so recommendations. So out of the review, there's some recommendations that were made by our colleagues. So the first recommendation was around what can we do as Public Health Birmingham City Council to retain yourselves. So in terms of volunteer retention, maintaining the terms of engagement, so upon which volunteers, so originally why volunteers joined or champions joined, ensuring that that's still there at the forefront. And if anything changed, it has to be consensual. There has to be a conversation with yourselves before we changed anything in terms of your roles. Volunteer recruitment. It's important that we clarify the role in terms of when we are recruiting volunteers, and also in terms of what support's available, what support will be available for our champions. And then the next thing was expanding the volunteers' roles. Again, people were kind of like not so keen on the roles being expanded. However, if there was a need for expansion of the role, then there have to be consultation and we'd have to get permission of the champion. Also as well, if the rules are changing, then it's around offering opportunities for those individuals for additional training, if there was any additional training. Also look at what support we could offer, and also look at what skills, do some sort of skills analysis or exercise with the champions, to see what they're actually bringing in for what they're already offering. So to conclude, in terms of the actual report itself, the aim was to explore with those individuals involved with the Champions Program, to find out their views and experiences of being on the program, and to identify factors related to their retention, recruitment, and how to explore expanding that. The findings indicated that maintaining the original terms of engagement with volunteers, so the original reason why they joined, was quite important, apparent. Adjusting these, there had to be some sort of consultation with yourself, and permission would have to be sought, and ensuring a reliable and consistent support structure was conducive for retaining the champions, ensuring that we could recruit more, and in terms of expansion of the roles, if it was to change, if we was looking at wider public health support or messaging around wider public health. Okay, so what next? After all of that, after all of those findings, we thought that it's very important that after sharing this with yourselves, we have a discussion in terms of how do you move forward? What does that mean? We've got the report back from University of Birmingham, the 16 participants that took part, or the 16 champions that took part in the review, their feedback. So, what do we do with that information now? Where does it go? So for the next part, I'm going to hand over to my colleague, Andrea, who will kindly facilitate the next part. We're going to break up into small groups, if that's okay with everybody.
Habib.
Yeah, sure, go on.
Hi, Habib. Sorry, I'm so sorry to interrupt. I'm just conscious of time.
Okay.
And making sure that our wonderful volunteers and champions have an opportunity to enjoy the rest of their evening. So I wonder if Andrea, Emily, Habib, you think maybe it would be best to do this exercise another week. I think that would be best, so that we can give everyone the appropriate time to really comment and digest what we've just heard, rather than rush through the next few minutes.
Yeah, sure.
Yeah,
sure. Yeah, and
great.
yeah, it makes sense. We can also share the report with the wider champions as well, give them an opportunity to have a read of the report and reflect on the findings.
Brilliant. That sounds really good. So I hope that's really clear, everyone. We essentially want to find out what we want to do next with these meetings, how we decide to go forward, how we can make sure that we're really using your time well, and that we can equip you to be the brilliant champions that you are. But especially as we're moving into a new year and lots of things are changing, and I'm sure, like me, you're probably all very tired. But we're now definitely in a new phase of COVID, and going forward, we really want to make sure that you have the things you need to do your job really, really well. So with that in mind, I think, yes, next time we will have a think about how we can just hear from you about how to make the role better, how to make these webinars better. What don't you like? What do you like? That kind of thing. And we'll spend some proper time really getting into the meat of all those things. So I hope that's okay. Steve. I'm not in the business of giving homework. I'm not a teacher. I don't want to give anybody homework at all. But if you would like to have a think about what you like about these meetings, what you don't like, what could be improved, and most importantly, what you need to do to be a COVID champion, please do make a little mental note and bring it for next time.
Yeah. The thing is, I just read Steve's comment, and it's not about reporting outputs. I think for us, Steve, as a team, you guys, for the best part of almost a year and a half now, you've been giving up your time and you've been doing this wonderful work. We just want to ensure that we give you all the tools necessary and all the information necessary for you then to be able to give the best information, because you are our kind of like eyes and ears on the ground in terms of the community. You're feeding back to us, what the thoughts and feelings of the community are. And then we're feeding information to you, so then you can share that with them. So you're our eyes and ears. So, unless we fully equip you, we can't expect then you to go out and share that information to the best of your ability. So that's all this exercise is about. I mean, if you're, I mean, the bottom line, we've had this conversation. If you're happy for the webinars to continue as they are, where you're getting a COVID update and you're getting the latest information and the way we're sharing information with you, you're entirely happy with that, then, you know, we're happy to go with that, because this is your space, and it's, you know, you're working in your communities, and it's whatever works best for you. But obviously we just want to review to ensure that we're doing what we can best to support you. And like I said, we will share the report. People don't have to read it. It's entirely up to you. I'm not saying you have to read it, but it's your report where your peers have fed back to us in terms of some of the changes that they'd like to see happen, or what they're happy with, or what they're not happy with. I just gave you a really quick kind of summary of some of the findings, and I really did it at speed, simply conscious of time. But I'm sure you know some people may want to digest that and process to find out exactly what it is. So hence we will share that report with you.
It's Steve here. It was really, when I said the homework, it was really just to say, do a YouTube video or edit what you've just spoken about, put that out as a special, and then a link for the next meeting, and say, look at this link and discuss, so we can discuss it at the meeting. So it's more effective for us. Okay, thank you for that. That's okay. So that's a wonderful idea. Yeah, we will. Quicker to speak than it was to type in. Sorry. No, that's fine. That's brilliant. That's brilliant. I do that sometimes. I prefer to speak rather than type. Anybody else got any other questions? Are you happy with what Shona just suggested? The fact that we look at going into breakout rooms at one of the future, well, if not the next meeting, the one after, because I'm just conscious of what's happening at the next meeting as well. If people are happy with that, then we'll go with that. Okay. Someone's asked if there's any update on. Oh, Steve has asked any update on long COVID.
So actually, one of the things we want to do at these meetings is to get some people in to really speak about some of these technical questions, because I have lots of questions about long COVID. I unfortunately don't have anything I can share right now, but we are looking into it to get someone to kind of give us a special session about long COVID and how we can look after ourselves in this new year. So thank you, Steve, for raising that, for reminding me.
Sadly, there isn't that much information out on long COVID, and there hasn't been. I know research has been done, but there's not much findings about long COVID, not that I've seen anyway. So I think it's something that long COVID, being long COVID, things are changing constantly, and maybe a year or 2 years time, we'll probably get more information about long COVID.
Yeah. Before we go, I just wanted to make a note that our next meeting, the Director of Public Health will be joining us. So he'll be with us, and we'll be doing a bit of a celebration to say thank you for all that you've done over the last year and a bit. So please do come along, and you can grill Dr. Varney yourselves. I'm sure he'll love that. So do come along and get your hard questions ready. But yeah, he'll be here next week, or next week, to kind of just say thank you and share his thanks, and we'll be doing a little presentation for all of you as well. So we look forward to seeing you then.
Before we disappear, has anybody got any other business or any other questions? As Shona said, the date of the next meeting is, I've got the date right. I was a bit nervous when I typed the date in. I guessed 2nd of February, and we will be doing kind of like a celebration event, and Dr. Justin Varney will be joining. Okay, if anybody's got no other questions, thank you very much for your time. Hopefully you will stay safe, and hopefully you'll all join us again at the next meeting on the 2nd of February. In between, obviously, we will have the newsletter out, and any other information that needs to go out will go out to you. Thank you very much, colleagues. Thanks. Enjoy the rest of the evening. Thank you. Poor Justin missed out on the news on this.